the urinary system for the practicals. Let's start off with two kidneys, the right and then the left. You'll notice that the right is slightly lower than the left, and if you recall, the liver is right here, just superior to the right kidney. You also have here the ureters, right, and then the left, and then we have the urinary bladder, and then somewhere down there is the urethra. Okay? So let's look at a closer view of our kidneys right here. So we dissected the kidneys and you'll see the structures. We have here your outermost covering, which is called the fibrous capsule. The outermost layer right here is your renal cortex. And then you have here your renal medulla, the inner layer, which is made up of this pyramidal or triangular, because it's a one-dimensional image you can see. These are your renal or medullary pyramids, which basically collect the urine formed from the structural units you find in the cortex, and they drain it into this small cup-like structures known as the minor calyx. The minor calyx will merge to give you bigger cups known as your major calyx. And then right here is your pelvis, an expanded funnel-shaped superior portion of your ureter. So if we're going to zoom into our next model right here, we have here your kidney once again, the capsule, the cortex, the medulla, then you have your pyramids, your minor calyx, your major calyx, the pelvis, and then the ureter. Now we're going to zoom into a section of our kidney and we'll see something like this. So again, this would be your medulla and this is your cortex. What you could see here are structures known as nephrons. We have about 1 million nephron per kidneys, and they are the structural functional unit of the kidney. They're the ones that actually filter blood and make urine. So let's look at the anatomy of one of our nephrons right here. We're going to zoom in. That's one nephron. This is what we call as the renal corpuscle. The renal corpuscle is made up of, let's zoom in some more. Right here is your renal corpuscle. It's made up of your glomerulus, which is a bundle or a tuft of capillaries, blood vessels, and then it sits on a capsule known as the Bowman's capsule. If we're going to zoom in, here is your renal corpuscle, the glomerulus, and then you have your capsule. Okay, this right here shows you the two ends of the glomerulus. This is your afferent arteriole, which enters the glomerulus, and this is your efferent arteriole, which leaves the glomerulus. Okay, right here, the Bowman's capsule is actually the beginning of your renal tubules. So we're gonna go back and zoom out again, right here. Okay, so that's your Bowman's capsule. This is your renal tubules, and it starts off with your proximal convoluted tubule. It's proximal because it's closer to the glomerulus. It's convoluted because it's curly or coiled. And then you go down to the descending limb of Henle, the loop of Henle, the actual loop. And then you have the ascending, because it's going up, ascending limb of Henle. And then here you have your distal convoluted tubule. It's convoluted, so it's also coiled or curly. It's distal because it's further away from our glomerulus right here. This is your afferent arteriole, which brings blood here, and this is your efferent arteriole, which brings blood away from the glomerulus. So what happens to this end? Now this end comes from the renal artery, which is basically over here. This is your renal artery, and it branches off and branches off until it becomes your afferent arteriole. But what happens, or what happens ultimately with this efferent? We're gonna look at this image. Your efferent arteriole, which is this, actually goes down and sort of wraps or encircles or runs parallel with your renal tubules. So wherever you have a renal tubule, you have all this peritubular capillaries, peritubular, around the tubules. And once they done their thing here, they're going to go back to the renal vein right here. This will ultimately go to your renal vein, which is here. No, all of this, the veins in the kidneys will ultimately reach the renal vein and then drain blood into the inferior vena cava so that it can go back to the heart. That is your urinary system. That's your kidney. This is a section of your kidney. We zoom in, that's one nephron. And then we zoom in further. This is the glomerulus of the nephron with some details of your renal tubules.